My name is Dr. Aaron Van Gaber. I'm a naturopathic physician. I work in beautiful downtown Vancouver. I started my training back in 1999, actually in Toronto. I worked as a pharmaceutical chemist before then, and I realized in the pharmaceutical industry that it really wasn't what I wanted to do. I wanted to think outside of the box, and studying pharmaceutical drugs wasn't thinking outside of the box. So in 1999, I started my naturopathic training in Toronto and completed the 4-year program and moved out to British Columbia in 2003, where I've been ever since. In naturopathic medicine, we look at the whole body. We look at everything from the head to the toe. We're looking at a person's lifestyle, social history, background, family history, to really ascertain where a person's at. We look at using the least aggressive methods of treatment as possible. We believe that the body has an inherent ability to heal itself. We just live in a very industrialized world with lots of chemicals, lots of industrialization, which has made it a little bit more difficult. Certainly with all the stresses that we've got, we can't live healthy lives without having a little bit of support. So that support that we use is as natural as possible. Things like herbal medicines, vitamins, supplements, Chinese herbal medicines as well. We can even do things like acupuncture. So naturopathic medicine is not a new form of medicine. It's been around for quite a bit of time. You know, what sets you apart? I've been asked that question so many times. What set me apart was actually my ability to let people just be themselves and open up. People tell me stories that they wouldn't normally tell other people, and that's a great starting point to really work on people's goals. Like types of services that I offer, there's quite a few of them, but the big ones that I really focus in on are IV vitamin therapies, and that includes general vitamins, minerals, also amino acids. The second big area is bioidentical hormones. So men or women dealing with hormonal issues, whether it's adrenal or thyroid, infertility, anything hormonal is another big service that I do. And then addictions and mental health. So if you're dealing with depression or anxiety or smoking addiction or food addictions, that's another thing that we can help you out with. And we do that using neurotransmitter testing, hormone testing, and other functional type tests that are not just blood, but based on salivary and urine tests. So it goes beyond what a conventional medical doctor would do. I don't just sit there and order a blood test. I get to know who a patient is, and I'll send them for different types of tests. So things that you wouldn't find from a conventional doctor's office. The other area that I focus on, and this has been something quite recent, is addiction recovery coaching and transitional planning. So individuals that have been in rehabs or are struggling with addiction and need a little bit of support. So not necessarily addictions counseling. I'm not dealing with the psychological aspects. I'm helping people with their goals. So meeting them where they're at and helping them get through their addiction. So recovery is a very long process, and it looks different for every single person. And my goal is really to help people find out what their recovery looks like for them and how to get there. The first thing a patient can expect when they come in to see me is a warm welcome. Normally it takes about 2 or 3 visits for me to really get into the root of what's going on. The first visit is usually an hour long. For some conditions it can be a little bit longer, and we just sit down and have a chat. It's really about getting to understand who you are as a person and connecting. Understanding where you're at, looking at things like your diet, checking into your family history. There's also times when I need to do a physical exam, so a complaint-oriented physical. Coming in for blood pressure issues, I'm going to check your blood pressure. And usually at the end of the hour, I send you home with some homework. And usually it gives you about 2 weeks for you to get your homework together, and that's usually filling out a diet journal, getting some blood work done, filling out a goals chart. And then after you come back, I take a look at everything that you brought me, and we put you on a treatment plan. And that treatment plan could be a 1-month-long treatment plan, it could be a 1-year treatment plan. And the idea is everyone's an individual, and it's finding out what specifically suits my patients the best. The best thing about being a naturopathic physician is seeing patients get to where they want to get. It's about knowing where they were and understanding their struggles and seeing that they can make big changes. And that for me is huge. One of the biggest success stories I've had was a young gentleman about 7 years ago Weighed about 250 pounds, was really dealing with some low self-esteem, came to me and wanted to make a change. And this was something that he had wanted to make a change for years, but just didn't have the support and didn't know how to do it. And it was amazing to see the motivation that he had when he came in, and he stuck through it. It took 4 to 6 months, and he had dropped 40 pounds. Started going to the gym, working out with a trainer, and completely changed his life. And those are the stories that I live for. If I were to give one tip to most anyone that I see, it's really be honest with where you're at. So if you want to actually get better, if you want to attain something, it's important for you to know where you're at in this moment. Don't lie, be honest. And only then can you really plot a goal to where you want to be. And so the idea is right where you're at, right where you want to be, and find out the obstacles in between that you need to work on. And once you outline those obstacles, you can then single them out and work on them individually.